Antônio Legovic, mi primo fire, możemy naciągnąć.
Good day.
Yeah, good afternoon. Good afternoon, Antônio Legovic. Good afternoon, ladies and gentlemen, distinguished viewers, and honored guests. A very warm welcome to this enlightening live session where we are about to embark on a journey of exploration into the world of quality education provided by Orenburg State Medical University, especially for Indian students. We are delighted to have you join us today for what promises to be an insightful and inspiring discussion. Myself, Dr. Dinesh Singla, your host for this session, and I consider it a privilege to guide you through this webinar. Our aim today is to shed some light on the exceptional educational opportunities that await Indian students at Orenburg State Medical University. And to do so, I have this distinct honor of being joined by the most dynamic and handsome Dean of Orenburg State Medical University, Assistant Professor Mironciev Antônio Legovic. We welcome you, Antônio Legovic, for this live session.
Thank you, Dr. Dinesh. I'm very happy that Dr. Dinesh today is full of the power. From this moment, I believe that our university will get a very big amount of students for our first course, and our job, everything that we're doing, we can give to new students who will come to us. Okay, guys, and everyone who are present here, this is how to tell you a very emotional topic, why Orenburg is the best option for MBBS in Russian Federation, but I'm a true person. I will tell you not only Orenburg, I already told this many times, other good universities we have too, but Orenburg truly one of them. And for my university, about my university, I can tell that 2 years ago, we was in the list of Forbes, and through all medical universities of Russian Federation who was present in this list, we was on second place. That's why I think this is very good result and powerful, one more time, powerful thing in this result was made by foreign faculty. It was made by you, dear students who will come for our education, or our dear graduates who are looking right now for this session. That's why I will show you some presentation, but I think that we can speak together with Dr. Dinesh during this presentation, because he was in Orenburg State Medical University as scientific worker during scientific education. That's why he knows Orenburg State Medical University inside. And maybe it will be interesting to him to speak about this together with me. Dr. Dinesh, you can see my presentation, yeah? It's
yes,
visible.
I can see your presentation, and definitely, Antônio Legovic, as you have informed that higher education, especially the medical education, is a transformative journey, not only for the students, I think for their parents also, because a student, he becomes a doctor. I cannot say that he becomes an individual, he becomes a doctor, which has such a responsibility on the shoulders of a doctor, because lives of people is in his hands. So this is our collective responsibility, that all our students who join Orenburg State Medical University have access to that world-class education. And the university, Orenburg State Medical University, has emerged as the beacon of excellence in this regard and has been attracting students, I would not say only from India, but from other parts of the world too. So I think...
And Dr. Dinesh, we can tell a little more, because right now, before this session, I had a speech with one group. This is second course. After 1 month, they will be on second course already. And half of the group missed many classes. I don't know why. And I asked them to come together with my voices. We speak, and really, guys, they can't tell real reason, sleeping or something else. They staying here and they can't tell why they missed classes. As Dr. Dinesh told you, you will have in your arms future success, but not only yours. This is success of your family, of your parents. And if you will decide another profession, economist or something else, same, success of your family will be in your arms. If you will get good payment for your job, everything will be good with your mother, with your father, you can help them in this question. But if you will be good doctor, one more thing will be in your arms, their health. Not only social, economic success of the future of your parents and other relatives of your family, but their health will be same in your hands. You can help to them. That's why come here to Russian Federation for education or abroad, maybe to other countries. You need to remember this. This must be your motivation, your future success and success of your family in your arms.
Yeah, Anton Olegovich, before we start this presentation, I just want to encourage all the students to actively participate in this webinar. Today's webinar will clear all your questions, all your doubts, and I do not think there can be a better person than the Dean of the university himself answering to all your questions. So please, your engagement will enrich our conversation and provide a comprehensive understanding about all the facilities for Indian students at Orenburg State Medical University. So I request all the participants of the webinar to please write your questions in the chat box or the question and answer session. And in the end of this live session, we will get all the answers from the one and only Dean of Orenburg State Medical University, Professor Mironchev Anton Olegovich. Anton Olegovich, I think we can start our presentation about Orenburg State Medical University.
Thank you, Dr. Dinesh. I'm associate professor. Not enough time for next scientific work for professor. That's why till now associate. What I want to tell at the starting, second starting of working of our faculty was from 2013. That's why it's already 10 years, and we will celebrate these 10 years of success. And I think you can understand that 10 years, this is big period. This is big duration by which we already got 4 graduates of our students. 4 graduations gave the doctors for Republic of India, and some of them already showed very good results. And we're proud about these graduates, about our students who showing in Russia good things of India, and in India they're showing good things of Russian Federation. This is our collaboration, our friendship between countries, and you as a graduate, this is the bridge between our countries. We organized at the starting a Russian language department, and guys, really, you will not have any problems with Russian language. You will get enough hours. It will be a big amount of on first course, but this is adaptation in foreign country, impossible to live without foreign language of this country. That's why you will get, you need to study, you will study, you will have teachers, good, this is women's, they're skilled, they are philologists, that's why no problems with language you will have, and even you will make tricks. Where you need, you will speak on Russian. Where you need, you will tell, I don't know, Russian, speak with me on English, not enough hours, not enough skilled, and so on. This is like a child who came to the doctor and telling, I not hear anything, and doctor telling, you want a chocolate? And child telling, yes, I want. Same with students.
Yeah, it happens when they come to Dean office, then they don't understand Russian language.
Yes,
when they have to talk to their girlfriends, they are very fluent in Russian language.
Yes. Correctly. I told that Dr. Dinesh knows inside information. And one more interesting thing, that during these years of education, we understood that not only foreign language, Russian, we need to give to our students, but we need to give English language. Because we give an English medium 6 years, we need to give English language to our teachers. We must be truly, and teachers need to speak Some will be better, some will be excellent, some will be a little less, but they must speak with students. They need to understand, they need to give material on English language and so on. We conducted the courses of Russian language for our teachers. More than 200, imagine 200 teachers of university gone through these courses. And right now we made these courses as obligate. All the teachers one time in 3 years need to go through these courses one more time on different levels. Starting on beginner, English knowing of foreign language can be divided into 3 or 5 levels. Beginner, pre-intermediate, intermediate, this is divided into 3 levels. We divide it into 5, for example, moderate and so on, and divide all teachers by the level of knowledge of English language. That's why they study. 358 students already got diplomas. Of course, first years of working of our faculty, we got less admissions because we was at the start line, and it's impossible. You can see here, this is open information, the 113 students at first year of the working, to 107 students, 161, and after this you can see that increasing of amount, two times from the 2016 year we increased the level of the students. And this is COVID years. You can see that the level was less. But here at the starting, university need to make many things for quality education. We need to perform understanding what teachers will work, how many classes we have, what we need to make with clinics for proper work of the students in these clinics, and so on. This is very big and serious work. That's why when this work performed, we can take bigger amount of places. What happened right now? Here you can see a dynamic growth of the years of education by the amount of students from first course, this color, up to 6th course, this color. But what is more interesting for you, this is surviving of the student from 1 year up to another. Let's look if in 2015 this was first year, after this is 2nd year, 3rd year, 4th year, 5th and 6th graduation. You need to understand, and from 1st year up to 2nd year, bigger amount of losing, but mostly this is because of students by themselves. If they're not motivated, they will not study. But your government made changes, and right now you need to pass through NEET. And the courses who pass through NEET, look here, 2018. Look at the 2nd course, near same amount, near same amount, and so on, and so on, and they are saving till last course at same amount. That's why really students who pass the NEET, they are motivated, they know why, they are prepared for this exam, they know that they want to go to biological medical profession at future, and this playing very big role in education in university. At the moment of coming of students, we conduct many meetings in which we give all information to students, how to live, what rules, what migration rules, where migration service of university, where is security service of university, what you don't need to do for not performing of the rules of university, and so on. That's why after this meeting, I believe that mostly students become calm, because they know this is our tutor, this is teacher, skilled person, this is rules which we need to make, this is place where we live. We're making adaptation excursion through our city, where we show main streets, main buildings, bibliothek, some clinics, campuses of university, of our university, and so on. That's why this meeting playing very interesting role. About workers who have gone through courses of English language, I already told to you. Literature, yeah, books of education. Many books we already have, they are on English language. With this we will not have problems. And another very good thing that we're making our own books, our departments, our teachers collectives, they're making their own books, which we have in our bibliothèque, our library, and you can get them too. Not only books who are written mostly by Indian teachers, Indian doctors. This is another very interesting thing, because we can understand that what is needful for you, it's knowledge of your doctors, because you have some specific things, and we're trying to make education of these things in our subjects. For example, in infection diseases, we have some block of tropic diseases, you know, yeah. On biology, you can sit right now and thinking biology. I got biology in school, but biology in medical university, in our university, first of all, this is another thing. You will have specific course of parasitology, which you really need in your future work, and so on. This is some of the books you can see. We have a very big account in biggest electronic library in our country. This is consultant of the student. And every student of foreign faculty can get their own account, their own cabinet in this electronic library. It means that on your laptop, on your PC, on your telephone, everywhere you can open the book and you can read material from this book. Because right now in this electronic library, consultant of the student, we have more than 100 English books. 100 English books, and this is professors and doctors and teachers famous in Russian Federation, and their Russian books was translated into English. That's why you can choose together with your teacher what is better. For example, for this topic, Indian book or Russian book on English in electronic system. From 2020-2021 educational year, we started specific field of our young scientific society of university. This is field route especially for Indian students. And it was a year of COVID. We performed it virtually. And you can see that parents participated in this conference together with their child's students of our university. And it was amazing that they can see what results the students, their childs got, even on second, on third, on fourth courses, not on fifth and sixth only, even on younger courses. We got very good feedbacks, and we saved this route for all other years and performed right now special route for Indian students. This is clinical session, clinical route of our scientific society. Government examination I'm showing you right now. This is first stage of government examination. This is tests, and we really understand that FMG, NMC, this is test, and you need to prepare for this test during your education. That's why on different departments we include tests from FMG exams of different years. That's why you can find them during your education and prepare. And after this, in government examination, very big amount of questions which was performed same as structure in FMG. That's why it helps to students too, to increase their results. And I will show you results. Right now we have one of the biggest results in our country of the passing of FMGs. This is second stage. This is a simulation, simulation with simulators and patient. 3 different simulations. In this stage, student need to pass with good result. Even reanimation. Here I'm showing to you results of graduation. Yes, you can see from 65 students, 7 red diplomas. From 58, 6 red diplomas. From 84, 3 red diplomas. From 141, 4 red diplomas. And this year, 2022, 2023, I forgot to make a column here. From 132, it was 8 red diplomas. 8 red diplomas. We became to same amount from the starting after COVID years. After COVID years, that's why we together with students made this work. I think that this is very good result. From 138 students with highest result in education, red diplomas. It means that their middle rank near excellent, near 5.0. By all exams, they got mostly 5. For getting of red diploma, your middle rank must be more than 476. It means that for good you can get through all exams more than 60. Other excellent, and it's possible for foreign students. That's why I shown this to you. I am trying to motivate you. If it's possible for this 8, you can be one of these 8. This is their names. You can see results. 496, it means that this student got only 1 good, other excellent. Organization of educational process, I told already many things. Preparation for FMG. For me, this is one of the main things right now, because we need to concentrate on the result which you need. You need to pass. Not only to get diploma from our university, you need to be successful after coming back. That's why we perform coming of lectures and teachers from India by different subjects who prepare for different disciplines. And I can show you, this is, for example, microbiology 2017. This is pathology 2019. This is pharmacology in 2019. It was clinical medicine, normal physiology, but it was mostly 2 different subjects in 1 year. But at this year, which was before September, we performed 4 different preparations to 4 subjects: biochemistry, microbiology, clinical medicine, obstetrics and gynecology. We performed this together with Rus Education. We need to tell them thanks, because we got 2 very qualified teachers. 2 of these 4 lecturers are among the top 5 lecturers in India in their specialties. Look here, one of them, Jain Priyansh, I believe you know him, clinician, and even you can see together with Jain, we spoke on different clinical topics. It was very interesting because our understanding of diseases, of qualifications on was same. And for me, it was very good because we're working by same protocols in Russian Federation and in India. That's why our program of education are close one to another country, and really Russian Federation is one of the popular abroad education countries. And another one was Prasan Vich, with very good course of obstetrics and gynecology for our students. Believe you know that he's top lecturer in your country too. Results of FMG examination. You can see that many years we ranged from 30% or more. But previously, only those who applied and passed the exam were taken into account. Now we have calculated the percentage of all graduates, not only of those who was applied. And you can see that from 2019, it was 4 times where students can pass. 4 times, 4 sessions of FMG. 78 already passed. Here 75, here 36. And graduates of last year, in December, they passed for 51%, 51. And this is a very good result. For Orenburg State Medical University, we got result bigger than 50%. Each second student who graduate can pass from first attempt final medical graduation examination. At the years of COVID, our students even got such certificates, our graduates. It means that at time when it's needful, they have enough skill, enough power, and they want to help to the country. It's very good motivation to other students. That's why I'm showing this to you. We're proud for such students. This is Vyas Vatsal Rajendra Kumar. He was chief of the course. I can tell you that when you come in here, you will, some of you will get a little extra social program. You will be chief of groups. You will be chief of course. You will be chief in the hostel. Because at future, you can be chief of the department in hospital. You can be chief of the department in ministry, and so on. This is your small but administrative work. This is your small but administrative experience, which you can get even here.
Anton Olegovich, I have one update for you. Dr. Vatsal, he recently cleared his PLAB examination, which is the licensing exam of United Kingdom, and he got his registration in London. So he's waiting for his few documents, and he will soon be joining the prestigious hospital in London and continue his postgraduate program there, and side by side he will be working there as a doctor. So that is a proud moment again for Orenburg State Medical University.
Yes, for university, this is very big proud. Of course, I telling to all students, this is your choice where you will work. But mostly you need to spend 1 year, few years, if you want to work in other country, but you need to spend for your country, for India. You need to make something good for your country. And Vyas made this. More than 3 years he was in India. That's why no? If right now it's possible to make postgraduate in United Kingdom, why no? We can only tell to him to get good results. Our clinical practice, it was very big question. Students need to pass industrial practice at some only in Orenburg, only in Russian Federation, or we can give permission to pass it in India. If we will give permission, we need to know that they really will make something. That it will be not only paper with which they will come back. That it will be real skills which they will get. 2 years we worked with Max Healthcare super specialty hospitals for signing of a contract between a university and clinic. And it was performed. We signed this contract. I believe that this year soon will be exhibition educational fair in India. If we will come, we will visit Max and maybe re-update this contract with them, because it gave very good opportunity to our students to pass and get very good skills. We was in the simulation center, and I can tell you that near 95% simulation center in university, same as in Max healthcare institution. That's why one more time we're looking at the same positions, at the same goals. And this is Dr. Vanita. She conducted many simulation courses in education in Max healthcare institution, and I can show you. This is one of our students. This is certificate which students getting from Max after passing of industrial summer practice. And one more thing you need to understand, this is little another maybe social work of university. With this certificate, you will get bigger chance to come and to get the work in this clinic. If you got the certificate, it means that you passed everything, really, not in false. Another interesting thing, on one department, this is Department of Common Surgery, it was situation for a few years when was not enough young teachers, and we understood that we need to increase the level of English very quick in this department, but professors was very old in this department. What we made, we got for the job Indian surgeon, and he worked on this department full year, and students passed exam to him of this subject of common surgery. And after 1 year, we got new teachers who are English speakers. Now, this is celebrating of Republic Day from 2017. We celebrate many holidays, Indian holidays. Our students can be not only red diploma students, highest result in education. They can be even best students of the region. And 3 of our students became the best students of the region. And this is very, very big result in education. One more time, it's possible and you can make. And of course, sport. I only will show you, this is, you can be the part of official command, official team of our university, by badminton, by basketball. You can see our students. We performed Festival of Sports. We started it from 2021 educational year, and as in this festival was badminton, football, volleyball, cricket, and here this is classes of physical training. Even at summer you will have skiing. That's why maybe it's funny, maybe, but it will be very interesting. Now this is new badminton team. This is football competition, volleyball, of course, cricket. In 2022, our command of our university became the first in cricket competitions between many universities. This is 2023 badminton celebration. We got 2nd place in competitions in the city Ufa. During year, we perform many meetings with students and even virtual too. Because if we need to make something very quick and give all information very quick, we can perform it virtually. And first time, rector and me, we performed meeting in virtual type together with parents because of world situation which happened right now, and parents was little afraid as they don't understand what to do, to send child or not to send for abroad education. And we answered on many questions which parents asked us, and after this they became calm, no questions, and we got good admission, a good year of education, and students understood everything. Even our students record videos and send them to the parents how classes is going on, how situation in the city, how situation in the shops, and so on. I can understand all emotional things. That's why I shown this to you. I can tell that in our city everything is calm, no problems, life is going on, work is going on. That's why we are ready, we're waiting for you. And I believe that if your child will study, they will get very good results together with our university. Thank you.
Thank you so much, Anton Olegovich. There are a few questions. I will read the questions one by one. So I think the first question was about the passing ratio of foreign medical graduates in India. That has already been answered by you in the slide, that almost 70-75% of the students have already cleared the FMG exam in India. So that has answered. Kindly provide details of hospitals attached to the institute, and what is the flow of patients? How many patients are there in the hospitals. So I think for the Indian practice, you have already informed about the summer training program. But can you just give a few
Yes.
points about the hospitals attached to the university?
Okay, of course, of course. We know about regulation rules that this is 5 years and 1 year of internship. And our program included this internship at the 6th year of education, where you have all clinical rotation work in different clinics by all subjects which are present in the list of NMC regulation rules. In our city, in Nuremberg, we have more than 12 clinics, big clinics, guys. This is thousands of wards with whom we have contracts that our students of our university can work in these clinics. And in these clinics, we have departments of university who work directly in the clinic. That's why you will get all skills, clinical skills here, no questions, no problems, and so on. I showed you already students who graduate and they really work. It means that they're skilled, they got this knowledge, and so on. We have trauma center, big, 1, 2, 3 regional hospitals. 1, 2, 3 perinatal centers, very big. And one of them was constructed 4 years ago. This is very up-to-date with up-to-date genetic laboratory. And our pediatrics department, for example, performed classes in this genetic laboratory for your understanding of genetic pathology. We have special physical sport medicine. Even this you will have, we have this clinic. Many surgical clinics, even child surgery clinic in which you will have child surgery classes and so on. That's why all clinics which are needful, neurological clinic, psychiatric hospital, 3 psychiatric hospitals, because they are regional, 1 city and other regional hospitals. That's why all classes you will have, which you need.
Thank you so much, Anton Olegovich. And I think the students should be made aware that there is ample amount of practical exposure that you are getting while you are studying MBBS or MD program in Orenburg State Medical University. And not only for your clinical subjects, but for your preclinical subjects like anatomy, you get ample practical exposure. We have live material on which you practice, including the cadavers and everything. You have organ systems there in place. Then in histology, you get slides of live material which you can see. In pathology department, in physiology department, you get to conduct various experiments on small animals also, operations on animals also. And once you are subjected to your clinical subjects, before that you practice all your skills on the simulation center robots and life-sized robots which mimic the patients. So you get practical exposure while you are studying MBBS at Orenburg State Medical University. And Anton Olegovich, I want to congratulate you, and it is your initiative to introduce the foreign medical graduate examination questions and the syllabus into the university curriculum, and which has helped the Indian students to get better understanding of this exam while they are doing their MBBS program from your university. And that is why they are able to clear that exam in the first or second attempts. And that is why the result of the Orenburg State Medical University is so high as compared to other universities of abroad. Anton Olegovich, there is one new regulation as per the National Medical Commission, in which student must get the license to practice in Russia. So there is one question that there is one exam that is needed to be passed after completion of the degree. So please, I request you to please say a few words about that licensing examination in Russia.
Okay, all students, Russian students, foreign students, after graduation from a university, after passing of government examination, they can or must pass accreditation exam. No, FMG in your country, this is accreditation exam. Accreditation of your medical skills. For our Russian students, of course, this is needful, they must. Foreign students, till this regulation, they can. Why we're telling can? Because you will work in Russian Federation or no? Depends on you. If you will stay, you will work. I have students who stayed in Russian Federation and they work. One of them right now came to ordinatorship. It's residentship, 2 years residentship by cardiosurgery. He wants to be a cardiosurgeon. That's why till this moment you can pass. And some students each year after graduation, they trying and passing accreditation of Russian Federation. They get a document that they can work as therapist, common doctor, as common doctor. After this is specialization to different fields of medicine. If in this regulation right now written that all graduates must get license for medical work, it means that all of you, after graduation, after passing of government exam, you must pass accreditation by the rules of Russian Federation. This is very hard, not easy, but it's possible because already 7 students passed accreditation. Who want, they can. Russian students, we prepare for accreditation. If it's written right now in norms and regulations of NMC, we will perform same courses of preparation for accreditation for our students. I can tell you more, because a few years ago, I already thought about this when we started to prepare a program of government examination. I saw that really it's possible that it will be needful to have this document, that it can practice in our country. And we make program of government examination near the program of accreditation. That's why this simulation which you will have, these tests which you are passing, they are near tests and simulations which you will have on accreditation. I think I gave the answer for this question.
Yeah, I also think so that Anton Olegovich, the 7 students who wanted to stay in Russia, they, without any special training, they went for this exam and they cleared this exam. So right now we can say that our university is showing 100% result for this accreditation exam. Any student who wants to stay there, they can clear the exam.
Dinesh, let be truly, not without special preparation, with preparation, but for example, Russian students start to prepare from September, October of educational year. Indian students, September, October, November, December, they think, I need accreditation or no. In December, before New Year, they coming, sir, I maybe need accreditation. I ask, why you want accreditation? Maybe I will stay. Okay, you will start preparation right now. Sir, let's start preparation in January. And they starting only from January, and it's enough for them. They passing tests, simulations, and so on. That's why preparation needful, but even from January, it's enough time for preparation.
So Anton Olegovich, now if all the students need this accreditation, I think university will accordingly set up the timetable or the schedule for preparation for this exam, for licensing exam, right?
Yeah.
Okay. Okay, so all the students are eligible to sit for this exam, and they can clear this exam, and university helps the students in preparing for this licensing examination.
Yes. During final year, we perform preparation of the students.
And there is one more question from Mr. Shivang Tripathi. He says that as per the Gazette of National Medical Commission from 2021, 6-year included internship is not valid. You will have to do a separate 1-year internship. there is doubt that Russia will increase its course duration to 6+1 year. So Anton Olegovich, if you allow, I would like to just take this question, because there is no mention of getting this of not allowing this internship, but still Russian universities have written to the embassy of India in Russia, and the embassy has sent its representation to the National Medical Commission, and I hope there will be clarification on this regulation soon, that the Russian degrees are fulfilling all the points mentioned in the Gazette of National Medical Commission, number 1. Especially, I would like to talk about Orenburg State Medical University. The complete course duration is more than 5.5 years, as stated in the Gazette. The complete...
Yes, it's really, yes, sorry for my words, beneath of yours, but we're making real 6 years of education. You need to understand this, not 5.5, not 5.6, not 5.8. You will have real 6 years of education. 6 times by 12 months as you will have.
And secondly, the complete duration, as per the rules of National Medical Commission, the complete duration of the course should be in English language. At Orenburg State Medical University, your complete course will be in English language. You have to appear for your licensing exam at Orenburg State Medical University. The university will prepare you for these licensing examinations, and our graduates who wanted to get this license have already sit in this exam and have already got that license in their hands, and they are practicing in Russia. So all the regulations mentioned by National Medical Commission are being followed, and your degree will be valid. So don't worry about that. Yeah, Anton Olegovich, you want to say something?
No, I think all the words was already told to our students, to future students. The last question, guys, I think this is a question in the field of politics between our countries, and this is regulation between ministries of healthcare, Ministry of External Affairs. They will decide how it must be written, how it must be conducted. Right now, we don't have any words against education, and education is going on. It's like as written and the regulations. Maybe we need to understand that many things in our arms. If we want to save this type of education, I mean abroad, we need to make universities, need to make very good graduates, very skilled, very experienced. We need to carefully look that only good material will come back, sorry for word material, but really material will come back to India. Same dear students, you need to understand this, that in your arms, what person will come back after 6 years in Russian Federation? Because you will come and you are not a child. You came for higher education, That's why this is your main role here. You need to study. You need to take and catch all material which you can. You asked about clinical preparations. All clinics are open for you. This work prepared already for many years by our university. But you will go to a patient or no? Or you will stay beside the spines of other students, and they will work with patient, and you will only look and hear what this patient telling. This is in your arms.
Yeah.
That's why I wish you to make proper decision about education. And if you will come, our university will make everything what possible. And that's why I wish you success in your future work, in your future education, and in your future understanding what you will do. Thank you.
Thank you, Anton Olegovich. Ladies and gentlemen, boys and girls, as we come to the end of this enlightening, I would say, live session, I would like to extend, first of all, my heartfelt gratitude, Anton Olegovich, to you, the Dean of Orenburg State Medical University, for joining us today and sharing your valuable insights. Your presence, I think, has illuminated our understanding of the opportunities for education that await Indian students at your respected university. I also like to thank and my sincere appreciation to the management, the Rukovodstvo of Orenburg State Medical University, for their commitment to providing top tier medical education to the students from India and around the world. Your dedication to this excellence and cultural exchange is truly commendable. To our viewers who have joined us from near and from far, I thank you all for being the part of this live session today. Today's discussion was both informative and inspiring. Education, is a transformative journey, and Orenburg State Medical University is a testament to that belief that quality medical education has no borders, and there are many things that can be done for the students who wish to study, who want to study, and not just take admission and come to a university, but who have that desire of becoming quality medical professionals. Before we say goodbye, I would like to make a small and a very humble request to you all. If you found this session valuable and believe that it can benefit your friends and peers in your network, please consider sharing it with your friends, with your colleagues, and with anyone seeking quality medical education abroad. Together, we can help more students make informed choices about their educational future. Lastly, please subscribe to our channel for more such informative videos so that in future you can join our live sessions, and don't forget to click on that bell icon so that you get notifications about our sessions. I wish again best of luck and best wishes to all the future doctors, medical students who are viewing this video. Remember, your dreams of becoming a medical professional are within your reach. It is within your hands. And institutions like Orenburg State Medical University are here to guide you on this journey of becoming exceptional doctors. Thank you, Anton Olegovich, for your commitment, for your ideas that you have put forward to the betterment of Indian students in your university. And today for sharing all those ideas and what the university is doing, not only for the study, but for the sports, for the cultural activities, be it celebrating the festivals, Indian festivals in Orenburg. And I really can't thank you enough. And we wish the university all success and a better future. And I wish all the students success, fulfillment, brilliant future in the field of medicine. Thank you, everyone. Take care and have a great day ahead.
Shukriya.